This exercise is for conditions such as patella subluxation, chondromalacia, arthritis, and other problems where minimal pressure on the kneecap and bone surface is desirable. Pull the foot backwards during the exercise to stimulate greater involvement of the quadriceps muscles. Place a firm padding such as a rolled up towel under the knee to elevate the knee slightly higher than the hips. Place support under the foot to prevent the leg from lowering more than 20 degrees from full extension. The total range is no more than 5 to 6 inches of movement using ankle weights. Extend the knee for 5 seconds with the foot pulled back. Holding the contraction for 5 seconds is especially good for development of the vastus medialis muscle, which will help to keep the patella from moving laterally. The purpose of knee extension is to develop the quadriceps muscles. Place a firm pad under the knees so that the knee is slightly higher than the hip. The upper body should not incline backwards more than 10 to 15 degrees. Straighten the knee slowly until extended. Hold the contraction 5 seconds with the foot pulled backwards. Holding the contraction 5 seconds will best develop the vastus medialis muscle, which is the major key to a sound knee. If the lower leg is turned outward, there is greater involvement of the vastus medialis. If the lower leg is turned inward, there is a greater emphasis on the vastus lateralis. Lower the ankle weight slowly under good control. Rest 15 to 30 seconds between sets. Increase the resistance as capable. The purpose of knee rotations is to provide greater knee stability. This will help prevent rotary knee injuries or as part of a rehabilitation following surgery. Medial knee rotation will strengthen the rotary ability of the semitendinosus, semimembranosus, sartorius, popliteus, and gracilis muscles. The subject is lying on the side with the knee bent at a 90-degree angle. The inside of the foot ankle is positioned pointing downward. The assistant places hand pressure on the inside of the foot with the remaining free hand on the heel. Beginning with the foot pointing downward and the rotated tibia in a full external rotation, apply resistance throughout complete internal rotation. Lower the foot to a starting position and repeat the exercise. Numerous injuries are related to torque rotation of the knee. Most knee exercise programs do not include rotation. The semitendinosus and semimembranosus are isolated along with the popliteus, sartorius, gracilis muscles. Fasten the Mattis ankle exerciser boot to the ankle foot. The subject will lie on the outside of the hip and bend the knee 90 degrees. Place a weight plate on the front pole of the Mattis ankle boot. Begin by moving the front pole toward the floor and rotate the knee inward, involving the front pole toward the ceiling. Do not allow the upper leg muscles to assist the movement. Lower the front pole slowly and repeat the movement. This exercise will help to correct the external rotation posture of the lower leg prevalent in majority of people. Medial knee rotation should be included in anterior-posterior cruciate problems, including post-surgery, or be an important part of training to prevent such injuries. If unable to obtain a Mattis ankle exerciser, tie surgical tubing around the front of the foot and fasten the tubing to a solid anchor. Number 16. This exercise is specific to develop greater rotary knee stability. The subject will lie on their side with the knee bent at a 90-degree angle. Place 16 to 20 inches of padding under the exercising top leg to make it near level with the hip. The outside of the foot ankle is positioned pointing downward. The assistant places hand pressure on the outside of the foot with the free hand on the heel. from full internal rotation, foot pointing downward, provide resistance through a full outward rotation with the foot pointing upward. Lower the foot to the starting position and repeat. Gradually add greater hand resistance to increase the strength. In attempting to prevent injuries, improve performance, help correct lower leg internal rotation, which produces pigeon-toed foot posture more completely, and rehabilitate anterior and posterior cruciate injuries, knee rotation exercises are important. Lateral knee rotation range is 50 degrees from full internal rotation to a complete external rotation. The biceps femoris is the primary muscle responsible for external rotation of the tibia. This is accomplished using the Mattos ankle exerciser boot. Lying on the opposite side of the exercising leg, place at least 6 inches of padding under the exercising top leg. Place a weight on the end of the front pipe and secure the weight. Begin the exercise from extreme internal rotation and complete with full external rotation. Lower the weight slowly. Do not allow the upper leg to assist the exercise. If unable to obtain the Mattos ankle exerciser, tie surgical tubing around the front of the foot and fasten the tubing to a solid anchor. Wall squats are for exercising the quadriceps, hamstrings, and many of the hip knee muscles such as the sartorius, gracilis, and tensor fasciae lata. Place the back of the upper body against the wall with the feet positioned straight ahead about 18 to 24 inches from the wall. Squatting a few inches from the vertical, remain squatted for 3 to 5 seconds and push the body up to full knee extension. Gradually work from a squat of 70 to 90 degrees. Advanced exercise would be progression to a regular squat or leg press. This is an excellent exercise to exercise the knee and hip muscles, including the quadriceps, hamstrings, gluteals, and hip flexors. Place one foot on a 6 to 12 inch stool. Move the body weight forward and extend the knee until the body is above the knee and lower the opposite leg back toward the floor. The same leg may repeat the exercise, or one may alternate legs. This may be part of a knee rehabilitation program, especially following anterior-posterior cruciate ligament surgery. This is a very good leg and cardiovascular conditioning exercise. Gradually add more sets or repetitions as desired. This is a more advanced exercise to strengthen the hamstrings, quadriceps, and gluteus maximus muscles. Step with 1 foot 3 to 4 feet of distance directly in front of the exercising hip. At the same time as the step, squat until the hips are near parallel with the knees. Resume a vertical position on a step squat with the opposite leg. When better conditioned, place a weight in either hand or use a weight vest to provide greater resistance. Wall squats, normal leg squats, or leg presses may be used.